May marks Skin Cancer Awareness Month, and experts at Canada's largest research hospital are warning about several dangerous trends that are exposing a new generation of Canadians to an increased risk of skin cancer. Joining us now is Dr. Butler. He is the site lead for melanoma at the University Health Network's Princess Margaret Cancer Center. Doctor, thanks so much for joining us today.
Thank you for having me.
All right, so when I was younger, tanning beds were the bad habit that many people gravitated towards to get that sun-kissed look. Now there are new ways that are just as dangerous. So can you tell us a little bit more about this tan maxing and UV chasing and why health experts like yourself are just so concerned about this?
Yeah, I do think it's a major problem. Ultraviolet light is a major cause of skin cancers. It may take years for the skin cancer to develop, but the damage that's caused by light, regardless of its source, can result in melanoma and other skin cancers.
And doctor, people who use tanning beds often say that they do it to get this base tan before going away on vacation because, they believe that it'll prevent them from getting a straight burn when traveling to a place that's much warmer than Canada where the sun is stronger. But I mean, is that true? What are some of the biggest myths surrounding skin health and tanning, would you say?
Yeah, that is not true. Ultraviolet radiation is cumulative, and having a base tan does not protect you from the damage that's caused by that. Yes, severe burns is associated with increased risk of developing a skin cancer later in life, but to prevent that based on having a tan does not help you and does not limit the amount of cumulative or the amount of total UV exposure that you have. So the best way to prevent skin cancer is to cover up and use hats and to live your life, of course, but not to expose yourself unneeded to ultraviolet light.
Well, doctor, I'm wondering, how does sun damage at a younger age to the skin impact a person's health later on in life? Is this something that can it lay dormant and then it can come up decades later if you had a really bad burn when you were younger?
Well, it's definitely true that the majority of people will have a lot of their sun exposure when they're younger, spending more time outside, not, spending your work day inside offices, etc. So, but that exposure to UV light and the damage that's caused will be cumulative over years, and the amount of damage that you see will be eventually result in enough mutations that result in a cancer that can occur late in life. One of the really interesting things that's recently been found in patients that have had a lot of sun exposure is that when you take the skin and you analyze the mutations that are present in normal looking skin, you can actually see many mutations that are associated with cancers. And that all those skin cells need is a couple of additional mutations in order to then become a cancer that could be life-threatening.
All right, so what are some of the signs and symptoms of melanoma to watch out for?
Well, anytime that you have a new lesion that appears out of the blue and certainly starts changing its shape or getting larger, this needs to be assessed by a physician and possibly require a biopsy.
All right, and doctor, what do the stats tell us about Canadians and skin cancer? How big of a problem is it here? Because I know, for example, Australia, they have huge amounts, high amounts of skin cancer rates, but how bad is it here in our country?
Well, we have a similar patient po the population includes many people that come from Northern Europe, and with the skin tones that are lighter, there are higher risk of UV damage resulting in skin cancers. We still see cancers develop in folks that are come from other parts of the world where they have higher pigment rate. But there's increased risk of additional types of skin cancers that you don't normally see such as mucosal and melanomas of the hands or feet that can develop in those populations as well. So anybody is at risk for melanoma and certainly need to be monitored closely for any new lesions that appear out of the blue.
And doctor, in terms of research and funding when it comes to skin cancer, have you seen that evolve over the years? Has it plateaued, or is there more research and funding going into this right now?
I think in general, there's been incredible success in terms of the treatment of patients with skin cancers. We have new drugs that are being developed for patients, and we've seen increased survival rates in patient populations that develop stage 4 disease that in the past would be a death sentence, but now folks are living decades later after their treatment. We still do, however, need additional research because we're not curing all of our patients that develop advanced disease. And we need more techniques to be able to treat these hard to treat tumors.
All right, it's an important conversation to have, especially during this month. Doctor, thank you so much for joining us and for your insights. We appreciate them.
Thank you.
That is Dr. Marcus Butler with UHN's Princess Margaret Cancer Center.